It's so great to be back at the Cantor Senior Center. You have the most fabulous executive director of any senior center in the state of Florida, arguably the country, and I wanted to come and talk with you what I've been doing across the senior centers in my district is coming to talk about the really difficult problem of Medicare fraud. Because I know that's something that you worry about every day, and it causes a tremendous amount of angst. And what I've done today, and I've been doing this all across South Florida, is bringing together experts to help you combat and make it less likely that you are a victim of either identity theft or Medicare fraud. And we're fortunate today to have extraordinary leaders in that effort from local organizations to discuss the issue and help you really figure out what steps you can take to safeguard your personal information. So as everyone in this room knows all too well, Florida has been a hotbed for Medicare fraud for too many years. From false billing to the pill mill epidemic, our large senior population has been a prime target for perpetrators of fraud. But thanks to important provisions in the Affordable Care Act, the health care law that President Obama signed into law 2 years ago now, we're seeing tremendous success in curbing Medicare fraud around the country. Not only will this decrease criminal activity that runs rampant in Medicare, but the funds recovered will generate significant savings to the program and thereby allowing us to invest in your healthy future. The Affordable Care Act's crackdown on fraud is already having incredible results. Last month, a federal report showed that the government has recovered $4.1 billion from Medicare swindlers in the past year, and that is the most ever recovered. It's a really big deal. Right here in South Florida, $58.6 million was recovered from overpayments. Because you know how you look at your bill and you see the list of services, if you look at your explanation of benefits, and you look at it and say, did I have that done?
Exactly.
Who is that doctor?
Exactly.
There are so many times when there are overpayments on that EOB, and I've had many calls to my office from seniors who say, you know, I'm just not comfortable with what I see on my explanation of benefits. We've been able to recover $58.6 million from those overpayments just in South Florida alone. Thanks to the Affordable Care Act. $10.7 million was collected from questionable outstanding bills, and $3 million, this is all in South Florida, was seized from companies that were booted from the Medicare program entirely because of their shady practices. Because, you know, there has been, through my entire time in office, years and years of talk about combating Medicare fraud, and finally, the Affordable Care Act has invested serious resources into making sure that we can finally crack down. Because it costs seniors more money. It increased the cost of Medicare, and it increased healthcare costs, the more billions that go out the door. And we are the Medicare fraud capital of the world, capital of the country, unfortunately, here in South Florida. And that's thanks to the attention and the action of seniors right here in our community. Because we're able to raise your awareness, and you're on guard and on alert, and paying a lot closer attention, which is fantastic. Now this morning, you're going to hear from the experts that I've brought to you to learn what you can do to protect yourself from fraud and to report suspicious activity if it happens to you. Now, of course, the first step in that is prevention. We want to give you the tools to make sure that you're never the victim of Medicare fraud. The most important thing that you can do is protect your Medicare account number and make sure not to share it with anyone. There are some easy ways to safeguard your Medicare number. Don't ever share it with someone over the phone. Be careful about people offering you free Medicare services. And never keep your Medicare statements out in the open where others can find them. You know, you might have an aide or someone coming in to help you in your residence. Not that you should not have trust in anyone who's coming into your home, but you don't need to leave all your personal business out on the kitchen table for someone who you're less than familiar with to see. You just never know. Better to be careful. But even though you're careful, sometimes fraud is unavoidable. And that's why it's so important to have citizens looking out for fraud to help combat these criminals that are trying to take advantage of you. The Senior Medicare Patrol has taken the lead on this issue, speaking to community groups about how to prevent identify and report Medicare fraud. And they're doing a fantastic job. In South Florida, seniors have blown the whistle on Medicare fraud. Seniors, by themselves, more than 54,000 times in the past 5 years. 54,000 times. And I'm so glad to have representatives of the Senior Medicare Patrol here today to tell you more about what you can do. And in Washington, we in Congress need to do all that we can to help this growing problem, help curb this growing problem. And that's why I'm proud to be a co-sponsor of the Medicare Identity Theft Prevention Act. That is important legislation that would remove your Social Security numbers from Medicare cards. Because that's the big problem, is that your Medicare number is your Social Security number. And so if they can get your Social Security number, that's the key to stealing your identity, filing your tax return, which has been happening more and more to seniors as a result. And it's really critical that we make that changeover. It's an effort to help to protect the 872,000 Medicare recipients that we have right here in South Florida. It's a bill that would require federal officials to come up with a cost-effective way to remove Social Security numbers from your Medicare cards and ensure that any substitute numbers are clearly not connected with Social Security. Floridians are especially vulnerable to thieves taking Social Security numbers and other government identification or benefits. More than half the reported identity thefts in the state involved government paperwork or benefits in 2011. And we're fortunate to have representatives from SHINE and the Senior Medicare Patrol here today to talk to you about what you can now introduce someone who's become a good friend and who is providing a tremendous public service, does an incredible job, really helping seniors just cut through all the morass and the clouds that seem to get created by the complexity of Medicare. And that's Sandra Colon with the Senior Medicare Patrol.
Good morning, everyone, and I'm glad to see all of you here and still remaining here to hear the important information that this event is bringing to you. I know it's been mentioned already how important it is to protect, detect, and report. Many people are, I'm sure, here in this room. Some of you have been victims of fraud, of identity theft, and perhaps became overwhelmed over what to do, how am I going to fix this, and this is such a hassle for me, and all the trouble it brings, and then how do I report it? Well, that's what the Senior Medicare Patrol does. We empower you in assisting you in protecting, detecting, and reporting, knowing where to report this identity theft, this Medicare fraud, Medicaid fraud, suspicions of it, and things that you may find questionable when you review your Medicare summary notice. You don't have to raise your hand, but I like to know, just think about it. Are you really reviewing your Medicare summary notice? Okay, really important. I know many people participate in receive their Medicare through the managed care plans, Part C, HMOs, PPOs, and many of them may not submit to you a summary notice on a monthly basis as they do when they're on regular Medicare. It does not mean that you don't have a right to request to see something from that HMO verifying for you, showing you, listing for you the services that the providers in that network might have billed that HMO. Okay, so keep it in mind that if you're in an HMO and you don't get a statement, you can request something so that you can also verify, because it is known that some of the doctors that were conducting, causing fraud outside in the regular Medicare world are joining into the HMOs, hiding in that network, and continue to try to do what they were doing on the outside. So you're not, unfortunately I have to say, you're not totally safe in an HMO, but just make sure, we have to protect, detect, and report. And the Senior Medicare Patrol program is a group of highly trained volunteers. We also recruit volunteers. And it's a program that is funded mainly through the Administration on Aging, and which has also received lots of the funding that the government has put into combating or stopping Medicare fraud. So we are basically the education outreach arm of the Affordable Health Care Act in getting the word out to you and helping others through you to get the word out to those who may not be able to do it on their own, who may not know anything about it. Protecting your Medicare number, as has been mentioned already, is the key. Your Medicare number, your Social Security number. Once they have that, then it spreads out. It grows all these tentacles like an octopus kind of thing, touching in every other part of your aspect of your life. All right. So we need to really protect that. If it's been already compromised, let me just tell you, about 90,000 Medicare numbers have been compromised in the state of Florida. That's just Florida. And one piece of news, Florida is moving away from being #1 in fraud. It's now Texas. Wow. So Texas is going to get all the glory for being #1. But truly, we are moving away from #1. However, Broward it's the second county in South Florida. It's Miami-Dade, Broward, it's the third county. Miami-Dade, Palm Beach, then Broward in fraud. And as they're getting squeezed up the 95 corridor, it's spreading all around Florida. So anywhere you live, it doesn't matter. And what I want to do is I want to tell you, we have a phone number that is statewide. That phone number is a toll-free number. That phone number does not require you to have to press different options. It makes it really easy for you to call. No one answers. Please make sure you leave your name and your phone number. You don't have to leave your Medicare number on that recording. Just leave your name and phone number, and Nancy or one of the volunteers up in Tampa St. Pete will call you back. Tampa St. Pete is the office, is where the office is that administers the SMP, the Senior Medicare program here in Florida. This is a national program. Anywhere you can use your Medicare card, there is an SMP. And so when you call that number, you'll be able to speak to someone live who will listen to and help you sort out the mess that has been created by any potential, scamming that you might have encountered. And that number is 1-866-357-6677. I know you can't, remember right off when I say it once, but I'm saying it because I have to say it, and I like saying it. Plus, it's going to be in all the information we have available for you. So I encourage you to please don't leave here without picking up some piece of information on SMP, which has the information that you need to have. And that phone number is very important. SHINE, we just have recently signed an MOU, a Memorandum of Understanding and Agreement, to work together. So whether you call SMP or you call SHINE, it's going to come to SMP, it's going to get routed to the right place. I want to give you some numbers because people like numbers. Let's see, I gave you the numbers on compromised Medicare and Social Security numbers in Florida. We are reaching, I think we're almost at the 50 million Medicare beneficiaries already. The healthcare fraud losses per year are estimated to be between 60 and 100 billion, still growing a little bit, but $4.1 billion in recovery is a really big break, okay? And it continues, and it is to the credit of the Affordable Health Care Act that this is happening, that they have been able to add in 8 more agents, more investigators to go out and be more aggressive in attacking the fraud when it happens. I don't know if any of you have ever called Medicare to report fraud or a suspicion, or called any of the numbers available, the OIG line, the Office of the Inspector General, but I just want to tell you, when you call those numbers, all the attention will be given to you as far as receiving the information, making sure that we have the right documentation, the right, all the information you have. But there may be a time when you may not receive any further information on what they're doing with that case. It does not mean they're not taking care of it. They are. But once it becomes an investigation, we want to make sure that nothing compromises that investigation. Because this is such well-organized crime. Am I allowed to say, it's like a mafia. Okay, it really is. It's so well organized. And they have excellent attorneys out there to defend them. So all the big bucks that they get, from their greed, it's going out to these other greedy, attorneys trying to defend them. And any little technical thing could just blow the case, and that's not what we want. So I ask for your patience and just be assured that the matter is being looked at and is being taken care of, okay? So, in looking at last fiscal year, approximately 1,700 healthcare fraud investigations took place. That's a pretty good number compared to the previous numbers. And 900 criminal and civil actions were done. The highest fine ever, or sentence ever, just happened recently, 50 years. That is sweet. I mean, I thought that was like, I really jumped up and down with joy on that one. It was 50 years and about 30-something and 30-something for the other two people that were involved. They were abusing, they were taking advantage of mentally ill people. Okay? They were so unscrupulous that it was just disgusting. It was not just the mental health services, it was also the assisted living facilities that these people lived in, so that they were participating by threatening these residents and saying, if you don't go to that place, then I'm going to kick you out. So imagine what that does to someone, especially suffering, from mental illness. You are victims because they think that once you reach a certain age, you don't know what you're doing. You don't have, you're like totally out of it. No, that's wrong. And they will prey on you continuously, no matter what no matter what we're doing. We need your cooperation, okay? Granted, the number may be out there already, but we need you, and without you, we couldn't do it. We need you to help us, to become part of the fight against fraud, not to assist them. The latest scam, as of last week, Key West, phone calls. I don't know if you're aware of this, but there is a new program that through the Affordable Health Care Act came out. It's a health insurance for pre-existing health conditions. Now, this insurance is an excellent coverage, and it's for sale. It's available for people who don't have Medicare or Medicaid. So you have to have no insurance. Well, they're offering this insurance as an additional insurance to people with Medicare and Medicaid. They're saying that they have additional discounts for you, and to make it real easy for you, you don't even have to leave your house. Just let me have, let's enroll you on the phone. Let me have your bank account information so that they can start taking the premiums out directly, just like they do, your Part D, or just like they do your Social Security, and you're set. And by the first of the month, you're on. Do not believe that. It's not true. The pre-existing health insurance, pre-existing condition health insurance is for people who don't have Medicare or Medicaid or any health insurance whatsoever. No, Social Security is not changing the Social Security number if your number was compromised, not yet. No, Medicare is not changing your Medicare card. I heard you say that you're working on a project to take the number off, but the cards are not being changed, the numbers are not being changed. Please, telemarketing is the biggest scam right now. Telemarketing, and they're very friendly. They're like, it's somebody that maybe from the center. They know you go to a center. They know what doctor you go to. They know how many children you have. They know who your neighbor is. They call you. They greet you very nice and warm, and then they start asking you to verify. That verification process that they use, that psychology, will get you into a conversation where you don't even realize that you're just giving them enough information for them to just abruptly cut the call off, because that's what they do. Be careful of calls like that, all right? They will purposefully give you the wrong, let me just give you the last four numbers of your Social Security number that I have, so you can verify. They'll give you a wrong digit, you're in this verification mode, and bam, you give them the correct number. That's all they needed. Click. And that's what they're doing. So please, watch out for if you don't initiate that phone call, if you're not the one making that call out to an insurance company, to a plan, to a drugstore, anywhere, if you're not the one starting that call, please be aware. Your information can easily be compromised by your verifying information to them. All they need is to know that that's the right information that they have. Okay, sometimes they just want to know, is this number belong to a man or a woman? So let me see who this is. Okay, please be aware. Help us. And I know inadvertently people, will just give out information. I'm sorry, this was a program that was built on honor. Doctors, we believe facilities, we believe, someone with a white jacket and a name tag on it. But in these days, we really have to be careful. We have every right as a patient to ask questions when you go to a clinic, when you go to a doctor, when you see somebody walking into that room you're waiting in that you never saw before. You can ask them their name, what their title is, what their expertise is, why am I here, why are you doing this, why not. There should be no fear of retaliation or poor health care from that provider. And if that were to happen, there's a recourse. You can call. You can call us, you can call Shine. There are places to call. You can call the Congresswoman's office to complain about that. There is a recourse to take against providers who do that in abuse of you, okay? Now, the Medicare summary notice comes to you once a month when you go to the doctor, after you go to the doctor, okay? In the folder we're going to give you, there is a journal that you can use to keep track of your health care. If you're not already using a notebook, if you're not already using a calendar to keep track of your health care, where you went, who you saw, what date it was it canceled? Did you have to reschedule the appointment? Did you get new medication? Was your blood pressure higher, lower? Your sugar up or down? Please keep track of it. This is a multi-purpose document. Why? It helps you eliminate the guesswork when you get the Medicare summary notice. That comes every month. And yes, it is being changed. And yes, it is already in electronic format at mymedicare.gov. So for those who are computer savvy, at www.mymedicare.gov has the brand new revised Medicare summary notice. That provides you with all your health care information, what was billed to Medicare on an ongoing basis electronically. But until it comes in paper, please write it down. You get it, just like a checkbook, you get, or an account. You get your statement, you match it against the information. If it doesn't match, if it's questionable, if you call the doctor and they gave you an answer that you weren't satisfied with, call the Senior Medicare Patrol number. It's on the back of that. Also, this document can be used, if there's an investigation of a case, they will use your records. It's better than just guesswork. Okay, remember. Yes, ma'am. You're going to get it today. I have some here. And if there was an emergency, God forbid, you have an emergency, there's no one at home, there's no one with you, and you have this with you, the paramedics or rescue can find this, they can open it, and they can see if you're allergic to any kind of medication, what your condition is. My mom has stents all over the place. She has to carry all these little cards and stuff in her wallet and have information on it. This provides that. This can be a lifesaver, okay? Watch out for Part D. You also receive a statement. We teach you how to read. We give you sessions on how to read that Medicare summary notice. And when the new one comes, we'll probably be going out there along with Shine, doing a lot of that training. We also have a handout, a guide that helps you follow it and learn all about it. And there's a key I'm going to give you about that statement. There's a little legend, there's a little letter at the end of the information on it when you're looking at it. That little letter is really tiny. You really need to magnify this. But that letter is the legend. When you flip it over to the other side, it tells you exactly what Medicare did or didn't do about that. Not because you see zero amount paid means that they didn't try to scam Medicare. So even if it wasn't your charge, if it was higher than what it should have been, if you went for an arm and they billed for a leg or something like, or your knee along with the arm and all that, even though there was no charge, a zero amount, it doesn't mean they didn't try to scam Medicare, and that is also punishable. Okay, so do report that. And one last thing, the Part D statement, the same thing. You get it every month. Okay, and Part D scamming is high. It's actually considered drug trafficking. And please pay attention to those statements. They are the way that you can help us protect, detect, and report. Okay, thank you. I'll be here for further information.
Thank you so much. And really, this is part of the public service that I provide to constituents, and I want to just give you